The research article which I read was about spirituality in nursing. The title of the research was Spirituality and Spiritual Caring, Nurses' Perspectives and Practice in Palliative and Acute Care Environments. The research was conducted by Susan Ronaldson, Lillian Hayes, Christina Agar, Jennifer Green, and Michelle Carey. The research problem. The problem of the research was to identify any perceived barriers of spiritual caring or spiritual practice within nursing. There were many aims and objectives of the research. One was to compare and contrast spiritual caring between palliative and acute care nurses. Another was to determine any relationship between spiritual perspective and spiritual practice within the nurse's life, which would then translate into their work life. Another was to investigate any barriers of spiritual caring within the workplace, and another was to contrast and compare the palliative and acute care models of caring. The reason that this research is important is because there has not been much research on spirituality in nursing before this study. This is mainly due to the nebulous nature of spirituality and the difficulty that our culture has articulating spirituality. The purpose of the research was to contrast spiritual caring between palliative and acute care RNs, as well as understand the practice of spiritual caring within the workplace. Another was to investigate any perceived barriers to spiritual caring between the two groups, the palliative and the acute care RNs. There was no theoretical framework which was identified, neither were there any variables or interventions. This is due to the nature of the study. The study design was cross-sectional, and while there was no theoretical framework which was identified, the study does add to the conceptual knowledge of spirituality and spiritual caring within nursing. The sample. 92 registered nurses participated in the study. Of the 92, 42 of them were palliative care nurses and 50 of them were acute care nurses. The study took place out in the metropolitan area surrounding Sydney, Australia. Within the study, data was collected over 6 months, and then later it was interpreted with descriptive and analytical statistics. Out of the nurses which were involved, of the acute care nurses, some of them were taken from orthopedics, medical and coronary care units, as well as general surgery. This led to a mix of medical and post-surgical units, providing many different environments of patient care within the study. Ethics approval was granted from the Institutional Ethics Committee before the beginning of the study, and all the nurses agreed to the study before it had begun. Data collection. The 92 nurses which participated in the study all completed a questionnaire on their own. There were also 2 validated research tools which were used, the SPS and the SCPQ. The SPF stands for Spiritual Perspective Scale. This scale measures the impact that spirituality has on their individual lives as nurses, as well as how it transfers into their workplace. The Spiritual Care Practice Questionnaire measures any barriers to providing spiritual care within the workplace, as well as the frequency and assessment of spiritual caring related to their practice. Results were considered significant if P was less than or equal to 0.05. The results of the study. The results of the study showed that palliative care nurses provided better spiritual caring to their patients. This is thought to be related to a number of different reasons. One being that the palliative care nurses were usually older and had chosen palliative care as their specialty, so this may have meant that they would have had an opportunity for advancement in their education and also as well as in their careers. The results also showed that nurses that were at ease with their own spirituality provided better spiritual caring to their patients. Barriers which were identified by both groups of RNs included insufficient time, and a barrier which was identified by the acute care RNs was patient privacy. There were no limitations on the study, although a proposed limitation was that because the RNs were acuted from a number of acute care environments which were targeted, that this could lead to a restricted sample. However, the diversity which was included in the study is thought to be substantial and significant. The implications which this study has for the body of nursing is to increase the profile and importance of spiritual caring within nursing. Another implication is to increase the knowledge and awareness of palliative and acute care RN's working environment. Recommendations that this study has for the body of nursing is to increase spiritual awareness and caring. It is thought that this is most successful if done early on in the nursing career. Another recommendation is to overcome the barriers which were previously stated: insufficient time and patient privacy on the high dependency units. It is also vital and imperative that nurses document and articulate their spiritual caring. They must document and also strive to articulate their spiritual caring with their nursing colleagues, as well as others on the healthcare professional team. It is thought that more research is needed to understand the problem which was identified by the acute care nurses and the barrier which was patient privacy on the high dependency units. It is thought that this study will potentiate further appreciation for spiritual caring, and it is hoped that spiritual caring will be enhanced in clinical environments throughout hospitals. In conclusion, this research shows that the palliative care nurses had more advanced spiritual caring. This could be for a number of reasons which were previously stated. And additional support is recommended for acute care nurses. Here is my reference, and I look forward to answering any questions and hearing your feedback. Thank you.